Welcome to the �ґ𝗏𝗀 podcast with Andrea Cox, the only plant-based astrology podcast focusing on hermetic principles, cellular detoxification, and mystery teachings. Andrea's interviews include her celebrity clients, NBA ball players, musical composers, detoxification specialists, and world-renowned healers just like Andrea. Andrea is a model-turned-celebrity detox specialist, intuitive healer, and holistic wellness and life coach. You will find only authentic people interviewed on this podcast. Real recognizes real. Andrea prides herself on only inviting those who are uniquely creative.
In a career spanning more than 2 decades, Dr. Joseph Esposito's experience as a health advocate has encompassed roles as clinician, researcher, writer, formulator, lecturer, and entrepreneur. Dr. Esposito is the founder and CEO of Aceva.
Yes, very good.
An international physician-grade supplement line, and AlignLife, a national chiropractic franchise with almost 40 clinics around the United States. His passion is to teach and implement integrated healthcare offerings using natural solutions to maximize patients' health. In his spare time, Dr. Esposito enjoys international mission trips and spending time with his family. I love that. I love the mission trips. That's
in a couple of weeks, and next month, Colombia, if you want to come.
Nice. So what do you do on the mission trips? Let's start there.
We provide chiropractic care. Sometimes you bring dentist and medical, but usually it's chiro. And one of the goals is to help change the legislation in these countries so we can open up for like more of a natural health movement. So we kind of try to dialogue with ministers of health and try to really change the infrastructure on these developing countries so they don't end up like the US with anti-health legislation. So change the world from the small countries and then hopefully impact the bigger ones.
Nice. And where are you based out of?
My companies are in Illinois. I'm out of Puerto Rico, but my companies are in Illinois.
Nice. Now, why Puerto Rico?
It's just so beautiful. I live on the beach. I'm on the 4 a.m. I'm running on the beach, 5 a.m, meditating. It's just a different life. Tax breaks. It's only 4% tax break. So there's no capital gains tax down there. And a bunch of my friends moved down. So it's a little enclave of health-minded health practitioners that are all hang out together in our own little world. So it's fun.
I love that. I love that. Now, it's interesting. Tell me what you do in your practice. What exactly do you do? What type of doctor do you do? What modalities do you include?
So we've expanded the offering, but I'm a board certified naturopath, a clinical nutritionist, and a chiropractor by trade. Mm-hmm. So I've spent, 25 years creating protocols all based on outcomes. So I study pre-post x-ray, pre-post stool analysis, pre-post blood test, pre-post salivary test. And I'm just obsessed with objectifying outcome in natural health because there's a lot of us fluffy granola people that we love hugging and taking care of people, but they think we're crazy that we can't get outcomes. So my personal mission is to document and provide research on the craziness that we do that actually creates a bigger innate impact to the human body's function than anything you could ever do in medicine. So that's kind of my mojo. So I pull all the data together of the clinics, and I'm going to be publishing some pretty massive research in the future. So right now, what do? We do chiropractic. So we look at the skeletal system and the neurological system. We do nutritional components like detox, reduce inflammation, drop the toxic load, balance blood sugar. We also have a program called 𝗵𝗵𝗶𝗍, which is metabolism for life, how to teach people how to create a metabolism that will run and function for the rest of your life versus starvation diets and all this stuff. But we documented the rules of metabolic function and teaching people how the rules work. This is how you stimulate this hormone that makes you full, and this one that makes you crave. We drop that because there's rules that make these hormones work. And we teach behavior, mindset, a relationship with food that is respectful and inspired versus addictive and emotional. So we teach video-based, food-based, just resetting the relationship and your stories around food. The 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪 program, we're excited because we just got our 5-year certification from the Center for Disease Control, being one of the only weight loss programs in the world that's certified to actually, it's documented to reduce the onset of diabetes with pre-post body composition testing, pre-post blood testing. So we just got a 5-year stamp, and that's opened the door to hospitals now using our system. So it's really my dream. My dad died and they gave him a drug because they made money on it. It was a patent, but it was the need for iodine. And I didn't learn this till a year later. And my dream was, I'm going to get nutrients in a hospital and change the way they operate. So they had me lecturing all 300 doctors from oncology, pediatrics, all over, and actually make an impact to the way they approach care to people. So that was my, like, I can leave the earth now. I did my thing. So
Yeah. So your dad had, I'm big into iodine. I use Lugol's iodine, and
oh yeah,
I put it in my water, and I actually put it on my wrists because, it goes into the skin.
huh?
About 30 minutes before I work out as well. I also do sit baths with it.
Good.
So I know a little bit about nutrition. I've been vegan for 26 years, but
Wow.
in a healthy way. So you lost your dad, and may I ask what the well, for YouTube purposes, I want to ask about the drug. So the pain of that is what catapulted you into
Do all this crazy stuff. Yeah.
yeah.
It's yeah, that's why I've done all this. It's frustration and anger just for the lying to people on that the body is not hopeless and careless and unintelligent. We don't need the guy in the white coat to save our lives and think that he has all-encompassing data and we're all hopeless. Our bodies don't know what they're doing. It's just a really bad culture that doesn't work, and it's proven to fail for decades. So yeah, so that's
Yes,
kind of
I just had 2 YouTube videos pulled down that had been up for 8 years, and one was on cancer and one was on Natasha Campbell McBride, the GAPS diet, and talking about, and of course Mushy will have to edit this out for YouTube. And it's sad that we have to go that route at this point. And I at this point in our journey, I think everybody's finally learning, but it's whistleblowers like, myself and yourself that really have brought this to the forefront, that are now questioning the norms, so to speak. And we know we can't trust the news. So I love this. So I 2 questions came up as you were talking, and you're a brilliant speaker. I can tell you know your stuff. Number 1 is intermittent fasting. Do you believe in intermittent fasting?
yeah, I do. I think it's overused and abused because of the obsessive culture of America. Any new health fad, millions of people jump on. You got to do that. But if you have an adrenal issue in your adrenal glands, what's going to regulate low blood sugar? And if you're doing this fasting and your body, you have insulin resistance and you have adrenal problems, you're going to stress the system more. So I'm a little more conservative than everyone do intermittent fasting. However, if we get people to stop eating a little bit, there is a lot of health that comes with it. So I can balance both sides of it,
I agree. And how do you get past the I've heard this throughout the years, and I love chiropractic. I have went to chiropractors for the last 20 years. I had a car accident when I was 27 years old where I went through a windshield, and I have a reverse cervical neck, spine, whatever. And it used to cause me mega problems. And I found a chiropractor in San Diego, and I went to him 3 times a week, believe it or not. He used all that stuff. And I go to the chiropractor maybe once a month now, and I just feel like chiropractic is so important. How do you get around? Do you still get, chiropractors have that stigma, oh, he's not a real doctor. Yeah, he's better than a real doctor. How do you get past that? Is that still around or no?
Not as much. Not as much. I don't notice that like 20 years ago. I mean, I built clinics in spine surgeon's office, OBGYN offices, medical. That was my route because I always wanted to go side by side to show what we do. I was that renegade guy, like, I'll show you, like, so I was always teaming up with medical to like be side by side. So I think it's different now, but it's an art form. And some of my colleagues don't respect the art. It could be like a painter and someone's taking finger paints and saying, oh, that's art. And then you have this Picasso and you say, no, you're not an artist. I'm an artist. Like when you deliver chiropractic, you use your hands, an instrument. You could use high force, low force. It's an art.
𝗟𝗵𝘂𝗽𝗀. Have you heard of that? 𝗟𝗵𝘂𝗽𝗀.
No, I haven't.
Okay, it's a rare form of chiropractic that I had done in San Diego. It sounds like a train wreck when they're cracking your neck. It's very quick and very forceful. I'm not sure that's really what induced my healing. I think that the other guy I found was, but you don't get that as much anymore, right?
Not as much, no. Not as much. I think it's the change of guard. It was 1979 where the American Medical Association put a letter out to the AMA, and it was intercepted. A chiropractor got a hold of it through a friend who was an MD that said we have to contain and eliminate this field of chiropractic because it's hurting our mission and our growth.
Okay.
And they lost the class action suit, and we won because they were trying to contain and destroy our entire profession.
Of course.
So all the medical back in the 60s and 70s were taught this negative, storyline. The last 10 years, all these young guys, they're all getting adjusted. They're all like, it's so different. The MDs that have been out 5-10 years, so much different than the old guard, so.
Yeah. Yeah. So, what I love about you, I want to know about your supplement line. And as a woman who's near her 50s, I would love, thank you. I would love to, well, actually, I didn't even hear if you said anything. I'm sorry, I'm just
you look great. You look great.
I'm used to saying thank you. And I didn't even hear. I'm so sorry.
Oh, you look awesome.
Thank you. So, I have been vegan for 26 years. I was raw vegan for 11 of those years. And then as I matured, I realized that, I really have to listen to my body. I do eat baked sweet potatoes and things like that. I eat healthy fats and things, but even I am worried about hormones. I mean, I still, get my cycle monthly, like clockwork. I don't even know it's coming. It's so, everything's perfect. Don't have any mood swings, no hot flat, nothing. And I'm just wondering, like, what would you advise for women in their, I would say, can we start at age, let's start with this. Because I have a colleague that's trying to get pregnant and she's in her mid-20s. What would you say to her as a suggestion to get pregnant if she's having some issues? And then we'll go into 30s and then 40s and beyond, nutrition wise.
A couple of different ways to approach it. One very easy way is we do lab testing, and we have an algorithm that with the lab, we send it through an algorithm, and then we pick the nutrients based on your labs. We put them in packs that are designed just for you with your name on them, roll it up month supply and send it to you. So you're not opening 6 different bottles and they're expiring at different times. It's like, this is your pack based on your blood. And in 6 months, we redo your blood and we modify the nutrient. Because I don't want to try to find 6 bottles and open them all. And I don't want to do that. Just give me what I need based on my own blood. So that's one program that I think is the simplest.
I'm doing that as soon as we get done here. I'm doing that. I want my labs done. Go on.
That's the easiest, simplest thing. But there's also like understanding. I loved when I bought a new car and they give me, when you got a new car, you keep it shiny, you wash it 4 times a day the first week, and you're like staring at it, you're like in love. And when they give you the new car, they're like, okay, at 2,000 miles, do this. At 5,000 miles, you got to do this. And at 9,000, this. And then 30,000, change the timing belt. If you don't do that, you're going to have this. And it's like, oh my God, this is like a plan for my car. So there is actually a plan for humans. Like, you should check your liver's detox cycle through urine collection once a decade. You should check your gut once a year. You should check your blood twice a year. These like oil changes or rotating your tires but no one follows any plan. They just follow crisis management. Like, oh, are you sick? Are you in pain? Do you have a symptom? No, I feel great. How do you keep me feeling great? So that's the issue with doctors. They're not really, they call it healthcare. It's really sickness care. No one really practices healthcare, which is maintaining people that have great health. Like, I have great health. What are you going to do for me? Well, we'll have a system to maintain your health. And no one really does that mindset. So
they get their blood taken. Now, could someone out of the country, could someone that lives in the Philippines reach out to you and do it?
Right now, no, but we do some work in Africa, UK, and Canada, but not all over the world. We're starting to build inroads. And this has taken off like, I didn't realize how intense this is when we made these packs. We bought this huge machine that makes these packs. And it is just in the last 3 months, it's unbelievable. Like we just had 900 clinics in Puerto Rico say, I want it all. It's like unmanageable. Because I think the convenience of it is what people are like, oh my God, I have to have this. So, but yeah, it's simple. And we get the lab and then you'll get a 20-page report that really lays out anything that's high or low in the lab. It really tells you in simple terms, what does it really mean? So you become really empowered reading this thing because it's simple, but it tells you about your body. So people really like that. And then your next test will be side by side. So you go look at, oh, this is better, this is worse. Right now, you go to your medical doc and it's just black and white colored paper, but they don't even show you the one before. So you don't even know, am I better? They just say, it's fine, or take this drug. We have it side by side and color coded, what's better, what's worse, so you can have a better idea.
Now, what's the main thing you see with women in their 40s going into their 50s? What's the main problem you see that comes up that you feel?
Well, the ovaries start sputtering out and they stop working like they used to. So what happens is the adrenal gland picks up the secretion of progesterone and estrogen. So you don't have hot flashes. You feel good. You still, your skin looks good. Everything's good. But most women are high sugar eaters, abuse caffeine, overly stressed. Their adrenal glands aren't working. So when their ovaries slow down or stop producing, there's no backup. So you have all these crazy symptoms they go through because the innate response of the body where the adrenal glands picks up where the ovaries stop is not working. So that's probably one of the numbers. Then you see the depression and you see the anxiety and these women, it happens from postpartum. They have a baby. The doctors look at the baby and they all take care of the baby and they throw the mom to the wayside when she has the baby. They're like, no one cares about mom. It's just the baby. And the mom is sitting there with nutrient deficient cravings, postpartum depression, and all these issues. And mom's just not taken care of. So I think it's from postpartum to menopause is a window that women, I don't think, are treated well.
Interesting. And so, I would imagine for adrenal glands, adaptogens such as, ashwagandha, ginseng, astragalus, things of that nature.
Yeah, you're right on.
Yeah. I grow 90% of the audience knows of my food, and I grow my own herbs, and I'm really into making my own tinctures. I should have been a scientist. So I'm into things that support the adrenal glands, but even I've noticed like more depression and things as I've gotten older. So that's interesting. I need my blood work done. And, how can people get a hold of you? How can they get in touch with, your lab and get their labs done and get all of their supplements? And do you find that it's not a one shoe fits all type of approach, right?
No, that's the beauty is it's based on you and your lab. So we have different programs. Like you could just do that program, or you can do it with a health coach guiding you, or a naturopathic doctor on our team, or, we have different levels we have dietitians, PhDs, nutritionists, we have health coaches. So we have the ability to scale something up based on their need. Most people have a certain economic exchange they're willing to do for a certain outcome. Well, time and expertise dictate the scale and where you want to be, but we don't control where you want to be. If you want just simple lab tests and a custom pack of nutrients, you can do that. You want to do that with a health coach to guide your own lifestyle, you can do that. So what we're building out right now is those tiers. That's not live, but right now you can go to Aceva.com and you can see these the process. I believe right now on the main site is a survey to custom packs. We've built a survey that is pretty wildly correlates to your lab, because we've done people with their lab and their survey and what nutrients would we give. It's not exact, but it's pretty crazy how interpreting their survey comes up with similar nutrient intake. So the simplest thing, the survey to a pack, is way better than going to your local big box retailer and picking up some vitamins you don't even know what you need, right? So yeah, Aceva.com is the way to go. And then you could ask questions there. We can get you with some of our coaching as well.
I love that. I want to move there now and become a coach with you. Coach on my own. So I have one more question. Methylation, MTHFR, all that. Do you see a lot of the homeozygous and do you see a lot of the gene mutations? I have it, so that's why. And it was a huge wake up call for me when I was 35. I gained like 70 pounds and had skin issues and was like on this raw vegan diet. What's going on? And I found out I have a gene mutation, so I'm curious about that.
Yeah, it's prevalent. The stats are right on, I believe, on what they said. I don't remember the number, but it's a significant gene mutation that you have to be cautious of. So in our formulations, we only use, the methyl tetrahydrofolate version. All of our nutrients are in the active state, so it doesn't require a lot of conversion inside your body. So yeah, they're all highly clinical formed, used by doctors, medical doctors, chiropractors, hospital, those type of organizations. So yeah, we're really proud of the actual, those are my babies, those formulations. So I say, take care of them, be nice to them, be good to my little babies.
Nice. Nice. We are so grateful. We're going to list all your links and check them out. Check his supplements out. He dealt with Maverick being needy today. So thank you so much. I really appreciate you coming on.
Yeah, thank you for the opportunity. I appreciate it.
Thanks so much for listening. If you'd like to check out Andrea Cox's most recent 4th book, Eat Right for Your Zodiac, it's the first book to ever combine astrology with plant-based eating. Andrea's Akashic record readings, holistic wellness coaching, and intuitive life coaching services are sought out by both celebrities and ordinary, everyday people like Andrea herself. If you'd like to connect with her, you can find her at AndreaCox.com, on YouTube at both Andrea Cox TV and The Detox Intuitive, on Facebook at Andrea Lee Cox, and on Instagram at Raw Chef Andrea.